The Community Paramedic Pilot program, that was a 6-month pilot, wrapped up at the end of March. What were the results of that?
It was. We had some really good results. It is wrapping up the end of this month. We had a 3-month that our municipal council funded for the first 3 months up until the end of the year. And then they got some funding through LINZ to carry on that pilot project for the 3 months, January, February, March of 2020. It's a community pilot project through the paramedics. And what we do is we send out a paramedic to call on high-risk patients when they're released from hospital. So somebody who's in risk of being readmitted to a hospital, and we know that there's a bit of a history there for whatever reason, rather than them going back and forth, we're trying to keep as many people out of the hospital if they don't need to be there. So this program, and other communities have done it as well, the paramedics will phone them, they'll drop in and see them. We have one specific paramedic to keep that consistent, voice or face in front of certain people. And they'll go visit them and they'll take their vitals and they'll check on them. And we've had some great results. And we wanted to do it as a pilot project to just try and get some numbers on, does this work at keeping people out of the hospital or for being readmitted to the hospital? And we're going to get a report at council, an overview of the pilot project, and we're hoping that it results in some long-term funding from the province. This is if the province wants to reduce hallway medicine and decrease the wait times at hospitals, in my opinion, this is a no-brainer, right? I mean, This is for a minimal investment. We've got results that are showing that people who are being readmitted to a hospital 6 times in 6 months, now that they're being called on by the paramedic at home, number one, they're more comfortable at home. Number two, they have a better peace of mind because they're at home. And number 3, they haven't been readmitted at all to the hospital. So they've got numbers that they can show that out of, X number of people who would have been in the hospital 30 to 40 times are now not being readmitted to the hospital, and the savings is quite substantial.
Well, sure, funding a single paramedic to do that versus all those hospital visits.
Exactly, but it's not just about the dollars either, right? I mean, it's about that person who's at home, and they're more comfortable at home. They're in a better environment at home. They're in their comfort zone at home, and for a lot of different reasons. Sometimes it's loneliness. Sometimes it's where they want to get back into the hospital, or there's a long-term care bed that they're waiting for, or they've been released and before their home care kicks in, there's a gap, while it's done. And in that time, a lot of these folks, these high-risk folks, are being readmitted to the hospital. Mm-hmm. And that's not the best place for them. And I think this program is showing it in certain circumstances. And our paramedics built up a great rapport with some of these residents, and they're excited to see them, and when they can't get to see them, they phone them just to check in on them. And like I mentioned, they take their vitals, they take their statistics, and they're doing well. And I think it's, in the long, so now we're going to take that information, we'll submit it to the province. And when these Ontario health teams, get put in place, and hopefully we have one in this area, then that'll be one of the asks for funding to fund this program. Other health teams that have been put in place across the province have already received funding long-term for some of these programs. So we're hoping when our health team gets put in place that we've got the data that shows this is a really good investment in healthcare in our province.
Well, and that makes sense. Even before the health team model was in the province, we had other municipalities doing similar things, whether it was using their paramedics or...
We did. It's just taking, something that it might seem like common sense, but it's a healthcare system that's been done a certain way for forever. And, to this government's credit, they're trying to find different ways and better ways to do that system while still providing, that service to our residents. And I think this is one way that's showing that, we applied to the LINZ originally to get the funding for the pilot project. They turned us down twice. For whatever reason, I don't know. So we as a municipality decided to step up, and we did the first 3 months. And like I mentioned, then the LINZ had a little bit extra money at the end of the year, and they decided to fund the last 3 months. And I think we've got some good results moving forward. So I would say the pilot project has shown it to be the success we hoped it would be. And hopefully that results in some long-term funding.
And did you say we'll get some more statistics on that soon in terms of...
We're going to get part of the pilot that once it wraps up and it comes to council, we'll get all the data on, how many people they called on, how many hours were avoided. It's $400 a day to be in the hospital. That adds up pretty quick. And when we can keep people out of a hospital, an average stay in a hospital is about 9 days. When we can keep them out of the hospital for 9 days, 3 or 4 times over the course of 6 months, that adds up pretty fast.
For sure. All right, well, let's jump around now to another issue, the area rate Tax Levy review. Maybe you could start off by just explaining to viewers what area rate means.
Yeah, sure. Area rating is when Kawartha Lakes amalgamated their city in 2001. The Kawartha Lakes special tax rate was a legislated act that was put in place by the province, which allowed us to area rate certain charges. So we have transit in Lindsay. So we have a bus service in Lindsay. The cost of that service is area rated to the residents in Lindsay. So nobody outside of the catchment area of transit pays for that transit service. We have full-time firefighters in Lindsay because of the population. That's a higher cost than our volunteer fire halls. So Lindsay and Ops, is area rated for our fire service full-time, and the rest of the city has a volunteer rate. It's called two levels of service. A service is full-time and C is volunteer. So they pay a lower rate for fire coverage than people in Lindsay would pay because it's full-time.
I don't think a lot of area residents realize that, to be honest, because we hear a lot of grumbling on our social media pages and so on about paying for what Lindsay gets and so on if they live outside town. So
police is another one. The OPP is when the OPP costs about the same for policing as the Lindsay and Ops police do, the Kawartha Lakes police, but your OPP is spread out over a much wider population base. So that bill on your tax bill might be, and I'll just take a shot, $300 on your tax bill for OPP policing. In Lindsay and Ops, depending on your assessed value, that might be $600 because you've got the same amount of money in a budget for policing, but you've got less people, utilizing that function. So sidewalk or street lights and parks are another one that are area rated because Lindsay has a very high volume of parks. So they've decided to area rate that to the people of Lindsay. They pay a little higher rate for our parks.
So we just have 1 minute left before break. So maybe you could just tell us about the fact that we're doing a review. And I think the province did a review and a special Kawartha Lakes Act. They're reviewing what we have here.
They are reviewing it. They're actually looking at possibly doing away with that, doing away with area rating altogether. Next year is the first year of our 4-year assessment cycle of homes. So, we've had other things area rated that slowly but surely, we used to have sidewalks area rated, for instance. We started to realize that everybody utilizes sidewalks when they come to town or whatever. So it was, over time, it was put into the general tax rate. And I think we need to look at, street lights is another one. They're area rated to people that have a street light by their home within a certain area. Well, I think we all, for safety reasons, utilize street lights at one time or another. So is that really something that should be area rated? So we're just going to do a look before the province decides where they're going to go with it and see if there's anything that needs to be adjusted in time for this next assessment cycle moving forward.